Hello, I'm April Farr, and I'm just here tonight wondering if those of you who so passionately and vehemently advocated and pushed to make masks optional in our schools are surprised when COVID infections increase. Judging from the lack of masks on most of law enforcement here tonight, it's safe to assume that they're not wearing masks in our schools either. Do you think that contributes to COVID infections? Thank you.
Next up, Josie Barnhart.
Good evening. First, I'd like to address the call to audience. I would propose that the call to audience be combined back into one period for board meetings out of respect for our public. One of the things I think that needs to change is the first come, first served sign up basis. So I'd like for us to think about that. In addition, I think that people can sign up to not only speak, but to sign up to transfer their time so that one individual could have an opportunity to speak for 10 or 15 minutes, having a longer, more in-depth speech, but representing dozens of our community members that deserve to be heard. Now, another thing is onto quarantines. In October of this year, quarantine protocols changed such that school nurses were not issuing them because some of them were issuing kids quarantines for 21 days. That is absurd for education. Looking over our data from October of 2020 to June of 21, roughly 1.4% of individuals placed into quarantine actually got COVID. That was over a 10-month period when a vaccine was not readily available. Tonight, I'm asking that schools remove themselves from enforcing quarantines on children without symptoms that have been exposed. While I encourage families who are sick to stay home and keep their sick kids home, the health department will notify families and that they will figure out the protocols that they need to proceed forward. The updated North Carolina toolkit that allows for medical discrimination of different quarantine protocols for those who are unvaccinated and vaccinated, as well as they don't mention the natural antibodies. Providing subpar education for anybody who is not fully vaccinated, unvaccinated, or has natural antibodies is downright discrimination and it's not acceptable. The learning loss created by mandating quarantines of healthy kids needs to stop. I'm asking you to do that tonight. We are not even measuring how much spread that we are actually eliminating in our county. With that being said, I hope that you make what is best decision as far as education goes, because our kids deserve to be in school learning. All of them, regardless of their medical status. Thank you.
Melissa Mason.
Hi, I'm Melissa Mason, and I'm here to talk about two things: changing the current quarantine policy and some misinformation that was spread to the media. First, the quarantine policy. As of right now, children are being placed under quarantine. As Josie said, some 21 days, most of them for 10 to 14 days. In recent decisions, the CDC changed their recommendations from 10 to 14 to 5. There was also discussion regarding a negative COVID test, allowing for a return sooner. I propose that we use these protocols since they have been recommended by the CDC. According to recent studies, the Omicron variant is much weaker than previous variants, and according to our data here in New Hanover County, there have been 0 hospitalizations of children. This virus isn't going to go away, but our students need to return to a stable and normal routine. Our children have already missed too much school. Secondly, misinformation. I want to address that because we were sent out a survey beginning of December as parents, whether we were interested in a vaccine clinic being offered at the various schools. If you are unaware of the questions, I would recommend you seek them out. The last question was kind of the most concerning to me, and it was, what time of day do you prefer to schedule the vaccine? There were 2 choices, morning and afternoon. There was no third option of, I don't want this. That put out a red flag to me, and when I read the article that said that all 612 responses to the survey expressed interest in a vaccine clinic, lots of red flags went up. I know and have talked to many parents who do not want this. Honesty and integrity do not look like this. Thank you.
Morgan Wallace.
I'm Morgan Wallace. I'm a 10-year employee of New Hanover County. I worked in the cardiovascular ICU for 5 years. I was your last line of defense for COVID. We ran your heart and lungs outside your body with your chest open while you were bleeding on the floor. And what I realized was that patients were needlessly dying because of government's withheld policies for treating COVID. Everyone who died with COVID should be considered murdered. Early treatment has always been effective. I walked out of the hospital on the mandate day. I have my own practice, and I am the only person in town treating COVID patients prior to hospitalization. I also watched the entire staff at the hospital, including in my unit, get vaccinated and then get COVID, amongst all kinds of other ailments. You have now loaded your body with millions of spike proteins, and you are a ticking time bomb for cancer, blood clots, and whatever kind of ailment may come up in your body. And I'm tired of hearing people go and ask doctors, can they be treated for COVID, and their only option is a vaccine or go home or go into the hospital where you're not going to make it out. I'll be happy to treat any one of you for COVID prior to going to the hospital because early treatment has always worked. I'm a member of the FLCCC Alliance, NC Physicians for Freedom, and the Medical Freedom Summit. And I would ask y'all to please stop choosing fear and putting masks on our kids. The vaccine is not going to work. Early treatment has always worked, and government mismanagement of patients is why people have died. And families have realized this, and they are rising up, and they are going to come after governments and the hospital. I was highly decorated and highly respected at New Hanover. I was the November 2020 Employee of Excellence, and I had a job opportunity this year from the chief medical director at the hospital, and I chose to walk out and stand up for what is right. So putting these masks on our kids is not going to help, nor is vaccination, and we all need to realize that. It is out, the cat is out of the bag, and people are speaking globally, including the inventor of the vaccine.
Okay, that concludes our call to the audience section of the meeting. Next, we will move on to consensus items.